Are you suffering with dark urine or any of the urinary complaints like your urine is very smelly, or you have bloody urine, or you have pain while passing urine, any kind of other symptoms? Then this video is exactly found you. Myself, Dr. Mega from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. Today in this video, I'll be talking about one of the best homeopathic medicine which is really helpful in the treatment of any kind of urinary complaints. Today I'll be talking about one of the favorite homeopathic medicine, that is the benzoic acid. What is benzoic acid? It belongs to mineral kingdom. This remedy is very important in homeopathic medicine because its main action is on the urinary system. Urinary system is one of the exit point of our body, and we also call this benzoic acid as Nash triose of offensive urine. Some people may ask, what is offensive urine? Offensive urine is nothing but smelly urine. Whenever your urine smells very bad, that time we call it as offensive urine. That's all. There's nothing other than this. Other being the one is nitric acid. Other smelly urines are sepia benzoic acid. I'll be talking about it later because nitric acid is very large remedy. Sepia is also a very vast remedy, so I'll be talking in the next videos. So today's video is all about benzoic acid. Where all the benzoic acid is used other than urinary complaints? It is used in asthma, gallbladder affections, cough, respiratory organs, diarrhea, enuresis, gonorrhea, gout, rheumatism, prostate enlargement. These are the places where you can really use benzoic acid, and these are the diseases where you can really kind of get cured with the help of benzoic acid if the symptoms have been matched. The benzoic acid acts especially upon the kidneys, urinary bladder, joints, and also on the respiratory and digestive tracts. It produces and cures symptoms of uric acid and with urine highly colored and very offensive with gouty symptoms. How the patient looks? The patient's look is very lethargic, pale face. These patients are highly chilly patients. Okay, we'll be moving on to the first. We'll know about some important symptoms of benzoic acid. What are the important symptoms? Urine dark brown and urinous dark odor, highly insatisfied urination, and it is also given in nocturnal enuresis. What is nocturnal enuresis? It is for children with strong odor of urine. The children who cannot control their urine. Rheumatic and gouty complaints with gonorrheal or syphilitic base. Asthmatic cough with expectoration of green mucus and extreme weariness. Diarrhea of children, stool white, very offensive, exhausting and liquid, solid running right through the diaper. Gouty concentration affects all the joints, especially the knee. Pains, tearing, stitching in large joints of big toe. Redness and swelling of joints. Most of the symptoms appear on the left side for this medicine, but many subsequently come on the right. Moving on to the urinary complaints. It has got marked action on urinary system. It is to be thought of an nocturnal enuresis of delicate children's, enlargement of prostate in old man. Very offensive urine is also seen, and suppressed gonorrhea even in many moderate condition when urine is strong smelling. Character of urine. Urine is dark, brown and scanty with urinous odor, highly insatisfied. There is excess of uric acid in urine. These are the urinary complaints of benzoic acid. Mainly we give when the patient complains of offensive urine or dark urine, dark yellowish urine, where the patient says that he has very painful when he wants to pass the urine. That time we give it, because here the character of urine is dark. This is one of the specific, because the urine should be dark. And if the patient complains of pain, the pain should be on left side. Then you can think of benzoic acid. The burning, as the benzoic acid is an acid group remedy, it should belong to the burning, because acid means it's burning, right? So the burningness should be there before passing the urine, or during passing the urine, after passing the urine, or in the urethral tract. There is burning. Burning should be present. Darkness of the urine should be present, and sometimes it is also brownish, the patient complains of, and scanty with urinous odor, highly insatisfied. The patient only says that his urine smells a lot, even after he flushes this out, but he feels like it's smelly. That kind of smelliness is there. Okay, and if some people are suffering with uric acid, there is excessive uric acid in the urine, then also you can give the benzoic acid. You can also give benzoic acid in suppressed gonorrhea and rheumatism, gout. Some points I'll be saying about rheumatism and gout, because it is also related to urinary complaints. What is the causation for that? Suppressed gonorrhea or syphilis. Where it is located, all joints are affected, but especially knee symptoms may go from left to right. I already said, if you are thinking of benzoic acid, it should be on left side. Character of pain. Pain, tearing, stitching in large joints, especially in big toe. Pain suddenly change their locality. There is gouty concentration, and due to the deposits of uric acid, cracking sound in the joints. What are the symptoms which may accompany in the rheumatism and gout? What are the symptoms which really come along? Very strong smelling offensive urine and generally dark. Rheumatism alternating between the extremities and heart. When the patient feels more worst during the movement, because these patients have so much of burning and chilling and dryness, everything. Open air also they cannot take for, because they have so much of they does not want to open space, uncovering at night, lying on the right side, because they have the left side affection, but lying on right side is very aggravated for them. When they feel better, as they are the chilly patients, you can come to know that by heat, by warmth, by hot drinks, in closed room or in warm room, like that. This is all about, means it was a simple explanation of benzoic acid, you can just kind of look into that. You can give the benzoic acid if the child is having any kind of urinary problems also, because it also goes to nocturnal enuresis also. The patient who is the children who are going to bedwetting, also you can just give the benzoic acid if the urine is smelly and dark. This was all about the urinary symptoms or urinary complaints of benzoic acid. I'll be ending this video. If you really like my video, please do like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video you will be notified. If you have any kind of suggestion for me about your favorite video, please do comment in the comment section so that whenever I think of doing next video, I'll be able to be motivated. Thank you so much. Have a nice life. Good life.